Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and welcome to day 19 of Waxvent.
Rattling through them, there we are, rattling through them.
Couple of days left.
Yeah, no long, just under a
Couple of
week.
days. Two patients in this compilation. First patient is mine. Now we've got this very kind of deep anchored, well, I would say it's a bit of both, bit of skin, bit of wax. We normally kind of see this with patients who struggle with dry skin.
Yeah.
Everyone obviously produces different types of wax, and the skin migrates differently out of everyone's ear, but really held in here. I'm trying to. No, it's quite a dry plug, as you can see. The suction is actually struggling to get a grip here. You can just see the standard size sonotube is just, we're putting too much pressure to try and pull it out. It's almost kind of losing the grip, and we're just sliding across the surface. It's this kind of plug is usually perfect for manual tools, for rose and insert, St. Bart's hook or the Jobson horn. But there's no real gaps here around this, and I don't really want to risk pushing this in further. We've got a tiny little one to the side there, to the right. But I mean, that would be quite tricky to manoeuvre around.
That's going to be an awkward angle to get into with the rose and insert. That one.
We're going in there with the rose and
There
insert.
you go. There he is.
Just nipping in that tiny little gap. Now we've pulled it forward slightly. There's going to be a little bit of pressure here now.
Look how hard that is. It's just not really penetrating in very well at all, is it?
You can see it's slowly starting to almost roll out. We're starting to roll this forwards a little bit. It's holding on better than what I thought it was, to be honest. We flicked off the end there. So now we've brought it forwards a little bit further. We're going to go deeper. We're going to just try and nip that rose and inserter into the wax a little bit further in.
Oh, that went in a bit further.
Yeah, we should be okay here. You don't want to move too fast, because you don't want to risk breaking it apart and leaving little bits further into the ear.
Oh, that's a good plug.
It's quite a big piece, actually, yeah. Patient was having some difficulty with the hearing. I think there's a bit of dead skin, like softer dead skin left, if I can remember this one. Yeah, so there's just a fine layer of dead skin left behind, bit of keratin. Yeah,
that's
fine. It's the fine end, I think, here. I think it does draw. It's got like a bit of a tail on the end here. There we go, come out quite nicely for us. Just mopping up some of these tiny little bits. There's a tiny little bit now left next to the eardrum. So we're going to just touch up against the side here, avoiding the canals. There you go. That's exactly what I was hoping it was going to do.
Yeah, that's good. It's always handy when it does that, rather than a big peel.
There you go. Well, we got 2 centimeters, I'm going to go.
That was quite a bit of skin, wasn't it, when you look at that? It, although it looks like a lot in the ear canal, sometimes when you bring it out, it doesn't look like much, but that was a fair size. Yeah. This is my patient. Lovely lady came to see us yesterday, actually. And she's had a sensation of something in her ears. Now, she has got a perforated eardrum, and she normally goes to a different clinic somewhere else to get her ears cleaned out, but had them done recently and still felt there was a sensation of something was in the ear. So I could see this, what looked like a little bit of wax to start with, but this is actually really old keratinized skin. So what we've got is this layer of keratin that's sort of concertinaed up at the entrance to the canal. That's what we can see here. So I'm just lifting that off the canal. I think listening to the lady about the other practitioners she saw, they tend to use something called loops. Now, loops are magnified lenses, and to hold the ear canal open, you have a little specular that you pop in there, like a cone shape, and then you work in the centre of that cone shape. The difficulty is when you've got things like this, keratin and stuff on the outside part of the ear canal, sometimes when you put the cone in, it can cover over that entrance. So what you're seeing is just a little bit further on than what you can see here with the endoscope. So you actually miss the fact that that's there, but you'll be surprised just how much of this comes away. And this is what the beauty of the endoscope, it gives us a really lovely view of the ear canal. So it's a really good tool.
Yeah, we both used loops in the past, vision is not as good.
No,
it's good enough to take some wax out, but I mean, for these more sort of complex cases where, you know, the wax is either really deep against the eardrum or, you know, just general tidying up really is a bit easier.
Yeah, oh definitely with the endoscope, because you can get right behind those tools all the way down, so you get to see a lot more of what's going on. So I've just taken that bit of keratin away there. You can see I'm just sort of trying to flick that bit into the bowl of the ear. There we go. Let's have a little look. I can see a section to the top right corner. I'm just going to get rid of this little flap of keratin here. So I'm just going to drop over the top and just drag that back. There you go. You can see it just nips that end off it there. But we can see up the top right corner there is more, well, it looks like wax up here as well. But this is actually wax and keratin as well, because you'll see this. You can see how that's moving when you get the suction tube onto it.
Yeah, you kind of hope it's loose in a way when you see these little bits. And if you put the suction tube close to it, like what it's doing there, you just kind of hope it just like
just
sort of
nips off the back
unpeels
end.
and just kind of pulls towards the suction.
But this one is not going anywhere. That keratin is holding this in place. And you can see now just how much was hiding in those corners. And this is what the patient could feel. So the sensation that there was something in the ear, rather than it being a hearing loss, there was this sensation in there. And that's what it was, all this keratin here in that more cartilaginous portion of the ear canal, a very outermost portion of the ear canal, which flexes, with movement of your sort of temporomandibular joint back here, with movement to that, your ear canal flexes like this. And that's what the patient could feel, was these layers of dry keratin moving under the layers of skin underneath. Sorry guys, our video paused again, which is probably why we changed position. I'll talk about something completely different. But we can see this long strip of keratin coming out of the ear canal now. We're all concertinaed up behind that particular piece of wax there. Just pulling on this. I've got the fine end on here. I don't want to run the risk of it whistling. But you can see it's just not really pulling away very well. There we go. We just managed to break it away there. We just changed position a little bit. So now we're left with this sort of flap of skin.
Oh yeah. You have to get a bucket of oil out.
I was going to have to for this one. Look at it. It's sort of peeling down nicely, but it's just getting a little bit stuck in places. You can just see there's a few more pieces to the other side, so I'm just going to try and take some of these away. I'm just checking really that it's not all interconnected all the way around, because sometimes that can kind of hold it in place. But if you take a look at this, there we go. You can see that it starts to peel down the canal.
God, at the start, it didn't even look like there was much in there.
No, this is it. I think this is probably what happened with the previous practitioner. I think they've popped the loop in and popped the speculi in and not really seen that at the entrance to the canal. And then this is so well disguised against the ear canal wall that you wouldn't really spot it. I think we're not going to get a tremendous grip looking at that. No, we managed to pull quite a bit of it off. Yeah. So I'm just going to go in and grab, just to get a much more a much deeper grip onto that wax, then, if you like, or a stronger grip on the wax. And you can see, look at that.
Oh yeah, wow. You'd be like a magician.
Keep going like that. But it all pulled away. But that's what the patient could feel, was all that kind of that sensation in there.
Yeah.
So I'm just going to get this last little dry piece off. Now I'm just above the perforation there, so I don't really want to do anything too drastic here. I don't want to be pulling like all the way down to the eardrum, just because I don't want to cause any further issues with that drum. But we're just going to get that grip there. There we go. You can see how it peels. Look at that.
So you don't want to run the risk of that kind of peeling right over down to where the perforation is.
There we are. You can see the perforation. Now, the patient never actually seen their perforation, so I did sort of zoom in a little bit just so we could see some of the middle ear space there. You can see that blood vessels and mucosal there and everything there. But it looks, I know it's a perforation, but it looks like a healthy perforation, which is good.
As long as it's dry.
Yeah.
As long as it's dry.
As long as it's dry. If it's wet or, you run the risk of infection and stuff like that, discharging ones are not nice. So we are just 15/16 of an inch.
Oh, goodness. 2.5 centimeters, I think we've got there.
We have, yeah.
Just under. That'll be happy.
Well, guys, thank you very much for watching our video today. Don't forget, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe. If you have earwax problems yourself, you can always check out the link tree in the description, and that will take you through the website, and you can get yourself an appointment with myself or the lovely Mr. Taylor Green. There you go. We shall see you tomorrow for day 20 of Waxvent. Bye, everyone.
Bye.